This is Eric So. I'm a foot and ankle surgeon from Lincoln, Nebraska, and we will be reviewing a case of ZYNRELEF usage in total ankle arthroplasty. We make a standard anterior ankle incision approach, and we perform the total ankle arthroplasty through the manufacturer's recommended technique. We perform a thorough irrigation prior to the final implantation of the real implants. Once we get the final implants in place, we do a final irrigation. And then at this time, we administer the ZYNRELEF surrounding the ankle implant itself. I take great care to apply the ZYNRELEF to the surrounding pericapsular and synovial tissue. That's where many of the nerve endings are. And so I go in a 360-degree direction and try to get that applied as much as I can. Typically, for a total ankle replacement, an ankle will accept about 4 to 5 milliliters of ZYNRELEF total. Once that is applied, then I perform a deep fascial closure of the extensor retinaculum in an interrupted mattress fashion. After that is completed, then I go to skin closure, again in an interrupted fashion. As you can see here, once you apply the ZYNRELEF deep inside the ankle wound, there really should be little to no ZYNRELEF that is extruded through the wound itself. And then you can go straight to your dressing and splint. This concludes this video. Thank you for watching.
Indication. ZYNRELEF is indicated in adults for instillation to produce post-surgical analgesia for up to 72 hours after soft tissue and orthopedic procedures, including foot and ankle, and other procedures in which direct exposure to articular cartilage is avoided. Limitations of use. Safety and efficacy have not been established in highly vascular surgeries such as intrathoracic, large 4 or more level spinal, and head and neck procedures. Important safety information. Warning: risk of serious cardiovascular and gastrointestinal events. Nonsteroidal anti-inflammatory drugs, NSAIDs, cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. This risk may occur early in treatment and may increase with duration of use. ZYNRELEF is contraindicated in the setting of coronary artery bypass graft, CABG surgery. NSAIDs cause an increased risk of serious gastrointestinal (GI) adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. These events can occur at any time during use and without warning symptoms. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Contraindications. ZYNRELEF is contraindicated in patients with a known hypersensitivity, example, anaphylactic reactions and serious skin reactions to any amide local anesthetic, NSAIDs, or other components of ZYNRELEF, with history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Severe, sometimes fatal, anaphylactic reactions to NSAIDs have been reported in such patients. Undergoing obstetrical paracervical block anesthesia, or undergoing CABG. Warnings and precautions. Dose-related toxicity. Monitor cardiovascular and respiratory vital signs in patient's state of consciousness after application of ZYNRELEF. When using ZYNRELEF with other local anesthetics, overall local anesthetic exposure must be considered through 72 hours. Hepatotoxicity. If abnormal liver tests persist or worsen, perform a clinical evaluation of the patient. Hypertension. Patients taking some antihypertensive medication may have impaired response to these therapies when taking NSAIDs. Monitor blood pressure. Heart failure and edema. Avoid use of ZYNRELEF in patients with severe heart failure unless benefits are expected to outweigh risk of worsening heart failure. Renal toxicity. Monitor renal function in patients with renal or hepatic impairment, heart failure, dehydration, or hypovolemia. Avoid use of ZYNRELEF in patients with advanced renal disease unless benefits are expected to outweigh risk of worsening renal failure. Anaphylactic reactions. Seek emergency help if an anaphylactic reaction occurs. Risk of joint cartilage necrosis and degeneration with unapproved intraarticular use. Animal studies evaluating the effects of ZYNRELEF following intraarticular administration in the knee joint demonstrated cartilage necrosis and degeneration. Chondrolysis. Limit exposure to articular cartilage due to the potential risk of chondrolysis. Methemoglobinemia. Cases have been reported with local anesthetic use. Serious skin reactions. NSAIDs, including meloxicam, can cause serious skin adverse reactions. NSAIDs can also cause fixed drug eruption, FDE. FDE may present as a more severe variant known as generalized bullous fixed drug eruption, GBFDE, which can be life-threatening. If symptoms present, evaluate clinically. Drug reaction with eosinophilia and systemic symptoms, DRESS. If symptoms are present, evaluate clinically. Fetal toxicity. Due to the risk of oligohydramnios, fetal renal dysfunction, and premature closure of the ductus arteriosus with NSAIDs, limit use of ZYNRELEF between about 20 to 30 weeks gestation and avoid use after about 30 weeks. Hematologic toxicity. Monitor hemoglobin and hematocrit in patients with any signs or symptoms of anemia. Drug interactions. Drugs that interfere with hemostasis. Monitor patients for bleeding who are using ZYNRELEF with drugs that interfere with hemostasis. Example, warfarin, aspirin, SSRIs, SNRIs. ACE inhibitors, angiotensin receptor blockers, ARBs, or beta blockers. Use with ZYNRELEF may diminish the antihypertensive effect of these drugs. Monitor blood pressure. ACE inhibitors and ARBs. Use with ZYNRELEF in elderly, volume depleted, or those with renal impairment may result in deterioration of renal function. In such high-risk patients, monitor for signs of worsening renal function. Diuretics. NSAIDs can reduce natriuretic effect of furosemide and thiazide diuretics. Monitor patients to assure diuretic efficacy, including antihypertensive effects. Use in specific populations. Infertility. NSAIDs are associated with reversible infertility. Consider avoidance of ZYNRELEF in women who have difficulties conceiving. Severe hepatic impairment. Only use if benefits are expected to outweigh risks. Monitor for signs of worsening liver function. Severe renal impairment. Not recommended. Adverse reactions. Most common adverse reactions, incidence greater or equal to 5% in controlled clinical trials with ZYNRELEF, are soft tissue procedures, vomiting, and orthopedic procedures, constipation, and headache. Report side effects to Heron at 1-844-437-6611 or to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including box warning and updated warnings and precautions for serious skin reactions caused by nonsteroidal anti-inflammatory drugs, NSAIDs.